All right, good morning and welcome. Thank you all for being here. My name is Mary Cleary. I'm a Senior Project Officer for the Region 2 Center for Public Health Preparedness within the Preparedness and Recovery Institute at Columbia University. So happy to have you all here for our first R2C in Focus webinar. Today we're going to be discussing our project Building Strong Community Emergency Networks. We're really excited to have you all here today. We have a relatively packed agenda. We'll start off with some welcome and introductions, kind of outlining the approach for the project, talk a little bit more about the goal of building the evidence base, open things up for a larger feedback and Q&A session, and then give y'all some next steps in closing. So I'm going to hand things over to our director, Mitch Stripling, to get us started.
Thanks so much, Mary. And good morning, everybody. My name is Mitch Stripling. As Mary said, I'm the director of the New York City Preparedness and Recovery Institute, which is based at Columbia University with our key partner, the CUNY Graduate School of Public Health and Health Policy. And I'm grateful to see people introduce each other in the chat. That's great. You're welcome to forward this link to anybody and everybody you want, both for this event and for the video afterwards. We're grateful to see you. My work has been in public health preparedness and response for most of my career. I've worked on a lot of disasters, a lot of public health emergencies, pandemics, sure, but hurricanes, fires, earthquakes. And there's something that's always crucial, despite what you might see on the news. Something y'all probably know better than I do is that the first people to help after disasters are neighbors. It's community members, whether you're in New York, New Jersey, Puerto Rico, the US Virgin Islands, or somewhere else, community members who step up first to help rescue people when their houses fall down, to help get people food when they're hungry, to give people shelter when they need it. And so for us, we wanted to focus on these groups, coalitions, community emergency networks, or CENs. Folks call them COADs, VOADs, long-term recovery groups, whatever the name is. It's a coalition of local organizations and people who are coming together to help their fellows in a disaster. So that's what we're going to talk about today. We at the Region 2 Center are working on this project that's designed to strengthen community emergency networks. So during this call, we're going to talk about that approach. We're going to talk about the structure of how we're gathering this information. We're going to talk about a collaborative that we want to form with some of y'all. And we want to talk about how everybody can participate in the growth of this work. So that's what we're going to do. This is the most exciting day of the year for me because I think that the next few years really will stand or fall based on how well each of our neighborhoods and communities can help each other in disasters. It's really important. So I'm grateful that so many of y'all are here to talk to us about it. So when we say R2C, which we've already said a couple times on this call, what is that? Well, at PRI, we were selected as the Region 2 Center for Public Health Preparedness and Response. Region 2 is New York, New Jersey, Puerto Rico, and the Virgin Islands. And CDC funded these centers not to kind of do ivory tower research, but to implement evidence-based strategies out in the world, learn from them, prove what works in terms of on-the-ground preparedness support, and then try to scale it. That's the mission that we've got for this 5-year award. So we're Region 2. You can see here this map of the country. There are 10 of these centers around the country. They're all working on similar projects, and we're connected to all of them. So whatever we learn here, we're going to make sure California knows it. We're going to make sure Texas knows it. We're going to make sure Florida knows it. And that means that y'all being connected to us are connected to this national network as well. In particular, PRI, in addition to being the Region 2 Center, is also the sort of coordinating partner for all of these centers. So we're working heavily with all of these centers around the country, figuring out interventions. Okay, so let's talk about here. What we did, the way we got to this point was that when we received this award, we convened a group of 30 or 40 leaders from around the region. Now, some of those were public health officials, some of those were healthcare folks. A lot of them were nonprofit leads. Some ran COADs in New York, New Jersey, Puerto Rico, or the Virgin Islands. We brought them together for a series of meetings and surveys and discussions to come up with a 5-year regional work plan. And the goal of that work plan was, all right, if we could work together to build capacity and prove what works, find the evidence in any areas, where should we focus? Where should we start? And what that group came up with, again, not us, this kind of group discussing together gave us sort of 3 places to start, which are the 3 initial projects we're rolling out with. Okay. Um, Project 1 is to work on the sort of official public health workforce. So in that project, we're going to be building environmental health strike teams. We're going to be working with public health emergency operations centers to figure out how we send resources from one state to another state or another territory to another territory. That's one project. Project 3, which is the one you see, the high school one on the right of your screen, we're going to be looking at high schools and building surge teams within high schools to help lower respiratory illness rates in those communities. Both of those are exciting projects. We're going to have future webinars to talk about them. But today, we're talking about the one in the middle, which is our priority project for this year, because we're planning to take some yardage, get a lot of stuff done, and evaluate it to try to gather some evidence about how community emergency networks can be most effective and what they need to get their jobs done well. So that's what we're focused on today. So if you'll go to the next slide, one thing that we want to talk to y'all about is your involvement. And this is really my key message. We're about to hand this off. We're going to talk about all kinds of things about our approach. But essentially, what we're asking y'all to do, if you're willing, is to fill out a 15-minute form that we've sent out. It's on the PRI website. You're going to hear a lot about it over the next few minutes. And that form is going to do really 2 things. It's going to give us an idea of capacity for community emergency networks around the region. So we're going to learn a lot. We're trying to work with the VOADs in each of the states and territories to make sure the right people get it. And that's going to help us inform our evidentiary approach. But also, and maybe more important for y'all on the call, as you're going to hear, we're going to use it to select 5 community emergency networks from this region, from New York, New Jersey, Puerto Rico, or the Virgin Islands, to join the collaborative we're going to talk about. And the idea is that we're going to fund each of those $20,000. And then over the next few months, they're going to work with us to figure out how to make CENs successful, how to support them best around the idea of canvassing your neighborhood. One key COAD function is often, after disaster, you check on everybody. So we're going to look at what you need to do that well, what support's needed there, and we're going to measure the success of that quantitatively to try to prove it, to go back to CDC and everybody to say, listen, we all know that COADs work. We all know that community groups reach out to their folks in emergencies. But to scale that approach, to make sure it's funded appropriately, we need this kind of quantitative evidence, right? That's what sort of funders and government officials are always looking for. And so that's what we're going to try to do over the next 8 or 9 months with these CENs. We'll also be, as part of that, trying to find 5 other CENs to act as a sort of a control group. We'll be working with those too. I don't want to monologue about it because we're going to hand it over to some other folks. But if you don't take anything else away from this call, fill out the form so we can learn, and then let us know if you're interested in being part of this collaborative. So I get to now have the distinct pleasure of introducing the team of folks who are working to support y'all as COADs, as community emergency networks around the region. First, you're going to hear from Angel Palermo, who's now a consultant and a great partner of ours. Many of you know her as the project director from the East Harlem COAD. We're grateful to have her expertise. She's going to talk along with Rachel Pilchloeb, who is an assistant professor at the CUNY SPH, and she's our senior scientific advisor and the PI from the CUNY system on this project. After that, you're going to hear from Rachel's going to talk about the evaluation. Suzue Saito, who's going to join our call a little later, is the head of evaluation on this project, and she'll be able to talk more, as will Rachel, about what we mean when we say quantitative measurement of effectiveness, what we're trying to learn. And I really want to highlight Cameron Nahar, the Community Engagement and Operations Manager from the CUNY School of Public Health, who's done so much work getting that capacity form together, and making sure that we can learn the right things from each one of you so we can figure out how to better support community emergency networks in the future. And finally, you already met Mary Cleary. She opened up this call and welcomed everybody. She's the Senior Project Manager who is coordinating all the work across the Region 2 Center for Public Health Preparedness and Response. You're going to be hearing a lot from us, not just today, but over the weeks, months, and hopefully years to come. We want to be a good partner. We want to be showing up in pragmatic ways that kind of raise all boats for resilience around our region. So we're grateful to get to meet you today. We're excited about this initiative and the idea of forming this collaborative. And I get to hand it over to Angel to kind of tell you how it's going to work.
Thanks, Mitch. I think Rachel's going to go just before me.
Oh, well, sorry about that. That's
Okay.
our first switcheroo. So over to you, Rachel.
Hi, everyone. As Mitch mentioned, I'm Rachel Pilchlob. I am based at the CUNY Graduate School of Public Health, and supporting this project focused on the kind of scientific component, working with Suzue and the project team around how do we think about this in terms of defining our terms and our approach and our measurement and evaluation and all that comes in between. So I'm going to take you through a little bit of how we are thinking about this process. We will try not to overwhelm you with the details, but provide enough information that we can all be on the same page about what we're actually anticipating happening. Briefly, and Angel, feel free to jump in at any time. Mitch mentioned, but we are using the term community emergency networks as a catch-all term, so to speak, that includes coalitions active in disasters, VOAD or COADs, VOADs, volunteer organizations active in disasters, long-term recovery groups, and other similar coalitions that are really kind of focused on the same or similar missions, having to do with being present in the community, being a community organization or group of community organizations that are playing a role kind of in supporting local populations when there is an emergency. We understand that these entities really provide a service that oftentimes government systems can't, because of who they are connected to and how they operate. And we think it's critical to really think systematically about how we structure an intervention that can support these networks. So what do we mean when we actually are talking about doing that? Next slide. Here is an overview of our process, and then I will turn it over. Mitch mentioned we are starting off with that baseline understanding of community emergency networks, and we are doing that by asking you to complete the capacity form that is available on the PRI website. We can certainly drop the link in the chat here as well for anybody who wants to do this or take a look at it while it's fresh in their mind. This is a form that is designed to be, that is designed to be filled out by the organizational leader or leaders of a community emergency network. So one representative or leadership representative from the network to tell us a little bit about your network, about how you operate, who you reach, the scale, a response that you've maybe been a part of in the past, and then really a little bit more of the nuts and bolts about how you share information with your community and how you think about canvassing, and specifically that really door-to-door outreach, because that is a function that we are going to be focused on for the purposes of this project. That form, it would be super, super helpful for you to fill out, even if this project is not something that you envision your coalition participating in, because as you may know, there's a lot that we don't yet understand about community emergency networks, about who you are, how you operate, how you do what you do. And if we don't know about it, it's hard to kind of advocate for those organizations moving forward or kind of get at that baseline sense of how we can build more. So we really would appreciate you taking the time. It shouldn't take you more than 15 minutes to fill out the form. Based on the results of the form, we are going to select 5 community emergency networks to be part of a learning collaborative, and we are going to then launch that learning collaborative. So this collaborative will provide resources, training, and support to strengthen the ways in which community emergency networks can operate and serve their community. We'll dive in a little bit more deeply to what the learning collaborative will look like, what kind of those activities will be. Angel will really be the leader of that collaborative, but the goal here is to really build a cohort or a group of networks that are working together and learning from each other and with each other to strengthen capacity. As that capacity is being built, one of the things that's going to happen during the collaborative is this notion of building a plan. And each collaborative member, so each network that's been selected, is going to receive kind of hands-on support in order to produce a locally tailored canvassing plan that hopefully strengthens and also kind of solidifies operations for the community emergency network in the event of canvassing and the need for information sharing. And then finally, to see how all those activities, being part of the collaborative, working on the plan, did or didn't make a difference, there will be kind of an exercise and an evaluation of this effort. Each member of the collaborative will host a canvassing activity, and we at R2C will evaluate that for impact. And so this is really kind of the trajectory of what we're hoping to accomplish with in partnership with you, and we're really excited to see how all of this unfolds. Next slide. Okay. So we have plugged this form a couple of times, and I will not try not to repeat it again, but please fill out the Community Emergency Network capacity form. It's a brief 15-minute form. If you can do it by February 10th, that would be fantastic. Again, this helps us understand your structure, your needs, your capacity for canvassing and information sharing, and this helps us select the 5 community emergency networks that can join the Learning Collaborative. As a reminder, you will be compensated $20,000 for your participation if selected. And over to Angel.
Thanks, Rachel. Good day, everyone. I'm really excited to be a part of this project and play a role in helping to develop even further the evidence base of why community emergency networks are a critical piece for keeping neighborhoods and communities that are often vulnerable and the first to really be impacted and often the last to be, recover from disasters and all kinds of hazards, that, hyperlocal planning and response is a best practice. And so this project is really an important activity to contribute to the evidence base. So I have the opportunity to be a part of this project in helping to establish and launch the Learning Collaborative of the first cohort of 5 CENs that will be selected from the baseline survey responses. And we're inviting this group to form a collaborative in the following way. And so how it's really going to look is that we're going to go on a learning journey, and the learning journey will involve 4 meetings over the course of 4 or 5 months between March and May. We're inviting, this will be virtually held largely given the region is large. There will be 4 monthly sessions. We will aim to build a locally tailored canvassing plan that will strengthen the CENs participating, their ability to be prepared and respond, their overall capabilities, specifically focusing on a door-to-door canvassing task for information sharing, and ultimately test the plan, the workflows, the roles, et cetera. And we'll build out a scenario and, of course, build familiarity around testing the plan through tabletop activities. And then along the way, build out, certain structures and resources that may be needed to monitor and reach the impact of the canvassing activity overall. And so, as you can see here in March, we're hoping to launch the first meeting, and the purpose would be to build shared language around, building out an operations plan, really think about, what are the sort of shared mental models and system level understanding we would need to adopt to understand the why and how of canvassing, and how canvassing may advances preparedness and quite frankly, just, ultimately equity and access to information and resources that the canvassing activity is intended to do. Through the second meeting, we're hoping to, translate high level, systemic structures in neighborhoods and communities into thinking about, well, how would we really, build an operational workflow to ensure that we reach as maximally and optimally the neighborhood or geographic area of interest. And of course, get into the weeds around roles and checklists and, actual tools to actually implement the canvassing activity. Over the third meeting, we're hoping that we will build, collective capacity to manage and interpret and report data in alignment with, what the Region 2 requirements are to just demonstrate capability in responding to a public health emergency. And then we'll hope to come back for the fourth meeting with the purpose to just finalize our standardized plan, that is customized to that specific geographic area of the CEN that is participating, ensure that there's operational readiness and that we can prepare for a scenario-based exercise and overall strengthen, the cohort across CEN relationships and really build a collaborative familiarity, understanding, and partnership. So that's the learning journey. In addition to this, on next slide, we're hoping to provide some additional resources. There will be a lot of materials and tools created out of this work together. And so we're hoping to build out a field kit starter pack that will be available to the CENs. We will also provide micro coaching sessions, which is an opportunity to meet with either myself or others to just receive rapid technical assistance on areas that the CENs are sort of working on and need support and some additional guidance. We will build out communication templates that are multilingual and trauma informed and in plain language. There's a lot of materials already out there in the emergency management literature and field of practice. So we're looking to leverage those existing materials and resources. And then ultimately, we'd like to be able to build relationships amongst the CENs and become familiar, with each other's strengths, challenges, strategies, and ways of thinking. And we're looking to pair up the CENs to work with each other and develop sort of a dyad relationship to support each other's plan development. Okay, next slide. So you've heard the phrase canvassing and so forth, and the reason for the canvassing is we acknowledge that CEN capabilities extend far beyond just information sharing and canvassing, but for the purpose of this project, we needed to be specific. We needed to have a specific and measurable task with clear linkages to preparedness and response capabilities. And this is why we chose, that a way we're going to demonstrate, building strong CENs is through developing a canvassing plan and specifically establish a standardized yet adaptable operational framework for neighborhood level door-to-door canvassing during a public health emergency or preparedness campaigns. And so we're hoping that through this learning journey, collaborative experience, we will be able to really build the evidence and ultimately contribute to best practice approaches to identifying at-risk individuals, how to provide accurate, culturally appropriate information on preparedness, prevention, and resources, how to facilitate rapid bi-directional communication between community members and response partners, and of course, strengthen local networks of trust, care, and resilience. And again, this is all about, using this specific activity to contribute to the evidence of hyperlocal response planning and preparedness. Okay, next slide. So after the 4 meetings and the in-between work and opportunities to connect and so forth, by the end of around late summer, we're hoping to have each of the CENs feel ready and prepared to activate their canvassing plan within their jurisdiction to perform a canvassing activity to test and exercise their enhanced capability. And we are, we will be prepared to ensure that each of the CENs are ready to go and be with them along the way as they activate this particular activity. From there, we're going to then evaluate and see how it went. And now I'm going to turn it over to Suzanne, who will talk about that.
So I think I'm gonna tap in.
Sorry.
Sorry. And as we mentioned at the beginning, Suzue is the measurement and evaluation lead for R2C. She was conflicted this morning, and we are working together on this. So I'll try and do the plan justice. And if there's further questions about it, we can do our best to get back to you about anything that's not clear. But to kind of connect measurement and evaluation to this larger premise of building evidence. We just kind of wanted to step back a little bit and say, we generally know that, or we think that it's critical. We hear from our funders at CDC that we need a stronger evidence base in this field, documentation of practices that are working and not just that they're working, but why they're working and how they're done. Either so they can be replicated or so that we can give more support to those organizations, or so that we can just generally advocate for our field of practice. And so we think it's critical, and what we heard from the region over a year-long process of trying to set the priorities that Mitch went over in the beginning was, we think it's critical to build evidence focused on the role of community emergency networks and what they do and how they do it. So there are a few kind of different objectives, big picture here, in why we are going to measure and evaluate the process that Angel just went over. So first, the goal is to demonstrate that community emergency networks really play this critical role in preparedness and response, that the CENs kind of do something that is unique and necessary for preparedness and response. The second big picture goal is to really document and disseminate, so share what works and what does not to improve the capabilities of community emergency networks. And we recognize that there's a lot, and Angel just said this, I'm just echoing that the CENs do that is not going to be part of this project, but we are focusing on bite-sized chunks. And I think if we find a process that works around this particular topic of information sharing and canvassing, we see a process that is has some effect, we can think about other topics that could be replicated in this process. So we want to figure out what works in terms of process and an intervention to support the capabilities of community emergency networks. And then finally, with that kind of demonstration and documentation and sharing, we want to hopefully attract additional funders and collaborators to this space, right? The goal is to basically have a document that can help us advocate for funding and support for the work that needs to be done in communities through community emergency networks. So next slide. So our kind of evaluation plan is roughly how we are intending to go about building the evidence. So the first step is that we are using that capacity form that we've asked you to fill out to select community emergency networks. That's basically gives us a sample frame for which to pull from. Once we select the community emergency networks, we are actually going to identify 5 additional CENs that can serve kind of as controls. So these would be organizations that don't participate in the learning collaborative, but would get some additional funding to participate in some canvassing activities so we can make some comparisons. We are then going to implement the interventions that Angel described, the learning collaborative, the micro coaching, the communication sheets, et cetera, to support and bolster canvassing capability. We are going to create standardized data collection forms, surveys, qualitative instruments by which we can understand and document the activities that have happened in terms of a process evaluation, the outputs that are produced by the community emergency networks, and then ultimately the outcomes that are hopefully achieved in the canvassing activity. We're going to measure things like timeliness. So how quickly is information able to be shared? Coverage, how many people are able to be reached? And quality, kind of is the reach connecting to the right people? Is the information helpful? What is the kind of strength of the activity? And then ultimately, like I mentioned, compare back to those community emergency networks that didn't participate in the learning collaborative, but would have some support to conduct an activity on their own. And that is kind of the overall plan of how we plan to evaluate the approach here. And we would be happy to share any further details and answer any questions about it in the Q&A, which is coming up just very shortly. Mary, back to you.
Thank you so much, Rachel and Angel, for that robust explanation. I think we're going to move forward into the feedback session and Q&A. I know Mitch has been triaging some questions in the chat. We're going to ask that folks raise their hand or write their question into the chat directly, and Mitch will kind of take us through the moderation in sort of a panel format with Rachel and Angel responding as well. So Mitch, I think that first question we might want to lead off with regarding the translation and considerations for Spanish speakers in our territories.
Yeah, and I'll acknowledge that we're doing this in English, and that right off the bat is unfair to people in Puerto Rico who don't have that as their native language. And they're as much a part of our region as New York and New Jersey is, and we want to make sure we create an equitable baseline. Each of the collaborative sessions that Angel was talking about are going to have Spanish translation. We're going to make sure that it's fluid and not sort of machine driven. So that's going to be there. We plan to work with whoever, since we don't know who we're working with yet, it's going to depend a little bit on who we choose as those networks as to how we do that translation, but we will work with that group and make sure people can communicate fluently in their native language in a fluid way for each of those sessions. I'll hit a couple of the others off the top. Thanks for the RAND study. You know, the CEN is the organization that we work with. That's true. Now that we're using that term because it's fluid, and there are lots of different kinds of organizations in this space. So really what we're looking for is an organization that's committed to this work, that is an existing COAD or an existing network that's there, and that has a fiscal mechanism to sort of receive the funds so that you can do the work appropriately. That may be a 501c3, doesn't have to be. We know a lot of COADs aren't, right? So our goal is to find representative COADs from around the region, and then work with them on the sort of organizational side. So CEN is a loose term. We know there's a lot of fuzziness in the space. We're ready to kind of work on it. The 4 meetings and activation, the time commitment is an important question. I will speak to the end part, and then maybe I'll see what Angela in particular thinks about the learning capacity. We are hoping that everybody who participates will do something like a canvassing day that we can work on evaluating. Now, we're not calling it an exercise because the way we're thinking of it right now, although this may change, we want to discuss this with the people that are in the collaborative. We're thinking of it as a day where we're able to roster members of the COAD together and actually do some outreach in a neighborhood, which would involve some knocking on doors and collecting data, and maybe sharing in preparedness information or information about extreme heat, something that's an actual info opportunities. In New York City, Be a Buddy programs do this. Now, I know a couple of things. It's hard to plan something like that. You need a team roster. You need a way to collect the data. You need the right information to reach out. That's sort of what the funding is for. And I know also that it's a tricky time for many of y'all on this call with the question of doing neighborhood outreach or knocking on doors. And so that is, that's something we're going to be working on too. So that canvassing thing, there's work there. That's why we want to fund it. Like, we think there's going to be some real effort. I'm going to see what Angel thinks about the collaborative. I'll just take Ella's question there too. The community outreach we're sort of going to be here to fund each group and then support and evaluate each group. So we're going to rely on each CEN to figure out how to do that outreach. Now we can help with translation. To Ella's question, if you're sort of saying, you want translated materials that are in there, but the organization of that would be in the hands of each group that kind of is funded. So y'all would be the boss, and we would be kind of be in the background sort of supporting and doing that. So at the end of the day, y'all would decide how many languages and in what capacity, some of those things. Let me just go to you, Angel, and see what you think about the commitment for the collaborative and all that.
Thanks, Mitch. Just to add on, we're looking that, the 4 meetings may vary in time per meeting, anywhere from 2 to 4 hours, with an opportunity to do some inter-session work between meetings. We are hoping that we'll start from a basic standardized plan and framework. And then collectively over the journey, you will be customizing and tailoring it and identifying, exactly what you're putting in the chat, like who's going to do this in this language and what are we going to do and how we're going to make sure these resources are available for this particular type of community that has a particular way of engaging with this type of information. So that's where that will get all generated throughout the learning journey. And we're going to pay attention to that, because often what happens is that there is a desire for communities to activate, and what doesn't get taken into consideration are the unique nuances and attributes of a community in order for the CENs to actually and the resources needed to meet those particular community needs, so that an effective canvassing effort could actually take place. So we want to really pay attention and capture all the ways in which this particular cohort begins to customize their approach to a canvassing plan, because what you do in Puerto Rico obviously is not what you're going to do in East Harlem, and it's not what you're going to do in rural New Jersey. So we recognize that, but we need to document it, and we need to demonstrate and show that when you actually try to do this, this is what works and this is what does not work.
I see Greg and if people, so Ella, I guess let me try to nail that one down. So it's going to be 4 sessions with homework in between. So imagine 4 4-hour sessions over the next 6 months, plus planning for this canvassing day, and kind of a preparatory virtual sort of planning session for the canvassing day. So 4 learning sessions, 1 sort of tabletop exercise where you're planning for canvassing, 1 canvassing day. And then in between each of those 4 sessions, there's some homework. So the session might be, okay, we need to create a roster of the people that will be involved in canvassing. Okay, we need to create a draft plan for how your organization thinks about it. So there's then intermeeting organizational work. And the part that's fuzziest for us is we don't know how much that intervening organizational work will be, because it depends on where you are as a COAD a little bit. If y'all already have formal rosters in your back pocket, it's easy. And if you don't, if you're starting from scratch, it's going to take some more work. So I'm hoping that sort of gives you an idea of that timeline. And y'all are welcome to raise hands too. Ella, I'm hoping that helped. Let me do Greg's question is about federal reporting. And then we have a question about bringing other partners in. So to Greg's question, this is funded by CDC as a cooperative agreement, which gives us some independence from federal reporting requirements. We're cooperating, we're not a direct grant funding. So we are reporting back on the aggregate, but there's not a reporting requirement for each organization in any way that they would have to share anything at all with the federal government. Now we'll confirm that. We'll go back to get a statement on that. We're going to be working on a Q&A, and I think that's an important thing to put in there. But that's my best understanding of that one. Now, the funding can be used for anything y'all want it to be. We're going to transfer you the $20K. We have to send it to one place, and then it's kind of up to you. You can use it for whatever purposes help you meet the deliverables that we're kind of laying out. So Moria, I see you raised your hand.
Yes, Mariah. Yes,
Hey,
so I
Mariah.
was wondering, I just wanted to confirm if we have lots of partners that we work with, if we get the zip codes and information through the canvassing process, could we just simply do the canvassing at one of the partner sites and have them fill out the questions?
So the let me say two things. First, whoever we select, we're going to work with on the final mission. What you're saying, initially I'm doubting it's going to work, and I'll tell you why. Partly what we're trying to do with canvassing is get a quantitative measure of the ability to reach a certain number of doors or streets or neighborhoods. So we can do some kind of percentage of, okay, in 4 hours in the field, a COAD could reach such and such many folks in these kinds of like geographic conditions. So it kind of depends. If there were a canvassing mission in a limited geographic area that was all partners, maybe, but it's sort of the model we're imagining is something like a model where a hurricane's gone through an area, you're doing a recovery canvas and you're kind of checking on folks. We're not doing that scenario, but that's sort of the measurement model we got. I feel like I'm probably being confusing, but it kind of relies on being able to do door knocking in a constrained geographic area. How did I do? Maybe Rachel, what do you think about that? Can you say that more clearly than I did?
Yeah, I guess I'll add two things is one, I think the premise of it depends, I'll echo that. I think that the Mitch is spot on that, we need to be able to understand, reach into community in a pragmatic way and then quantify or measure that. If we hear that across all CENs, okay, well, people just actually come to our location, we're not going to their locations, maybe we evaluate how we conduct an activity that would be the case. But I think our initial plan was that there would need to be activity organized by the CEN that goes outbound, not that individuals are coming inbound to a given location. But I think we can we'll have meaningful conversations to figure out what actually works in the field. And yeah, you could go to people in a community location, but I again think that we can have some thoughtful conversations based on which community emergency networks are involved. But some of the nuts and bolts of how each community emergency networks operates, how they vary, and what's going to be meaningful for them are perhaps difficult to triage at this juncture when we don't yet know who is going to be in and how the plans will be designed for them.
Yeah, thank you. I think part of it is there's a line we're working on here. Getting a lot in the chat, would love it. Would love them. Let me try to hit a couple. There's a line we're working on here where what we have to do per CDC is essentially run a test. So we're not, and this is actually not the best. Like I wish this maybe weren't the case. Our goal for this year isn't to develop sustainable capacity the way a lot of great programs like Strong Communities do, or in New York City, the health department funds do for COADs. Like what we're trying to do is run an intervention and test the function of it to try to prove the workability of it. So Mariah, to your question, I agree with you that in an outreach capacity, going through partner organizations is more effective. Like just hands down, bringing everybody in a network is the more effective way to go. For us to be able to run a test, we have to have everybody reach out in the same way with a measurable goal. So like what you're saying absolutely makes sense operationally, but we have to kind of test everybody using the same language. And I'm happy to do more on that, but let me kind of hit Jill's and Keith's. So Keith is saying, and this is a great question, you're worried because you're working on this at the state level, and you want to make sure that this work is connected to those structures. And we agree with that too. We actually, the second part of this initiative that the leaders we worked with around the region came up with is to work on that kind of interstitial networks to figure out what we can do to prove that those network connections are there and supportive, and figure out how these hyper local groups can get connected to EOCs more effectively. And you're probably going to be our first phone call on that. With CDC, we kind of decided we had to start at this level first. And again, we're not trying to build a new system. What we want is for people to be doing this the way they would do it anyway, just in a way that we can kind of test it. Let me know, and feel free to come off mute to kind of take that. Let me hit Jill's question about the controls. Well, maybe, so Jill's asking about control groups and the variables that are there. Rachel, do you want to take a try at that one?
Yeah. So agreed. Point well taken. We agree that it's going to be difficult to control for all variables. We intend to select CENs from similar locations that identify as of a similar size in terms of volunteer capacity, community served. Now, we will not have perfectly matched controls. We may not have well-matched controls. The goal is to see across the process measures and the sort of the outputs that we have identified for the purpose of this project, ability to create a plan, to implement the plan, to develop materials, and to reach, community members. Is there variation? I think that in an ideal world, we would have the ability to do a great randomized community trial of all of these activities, but we don't have that ability, and we certainly don't have that funding. So our thought is to do some matching related to this canvassing activity, just to see if we can identify any variation in some of these outputs and outcomes that we are pointing to in the project across similar geographies, sizes, and community focus. And would be happy to have a conversation about any insight around which things to focus on when doing that matching. Some of it is really going to also depend on who completes the form and is willing to participate. So there's a lot of imperfects, I think, in this design.
And I think also there's a question from David about whether the funding was going to be subawardee or contractual. We are still working through that. We don't want to commit to one way or the other. We are committed to a model where when you receive the money, you get to allocate those funds in whatever way works most for you. And we think we can do that however we do it. That's easier contractually. And this is getting a little wonky. It's much easier if it's a contract and not a subaward, but we're working with CDC to make sure it's true in either case. And I think that to Tito's question about tornado response, Tito, you're kind of sort of saying, hey, in a real world, you want to do this with social media, you want to do it through local partners, and then you can merge those data together to figure out who you're reaching. And I agree. I think that's exactly right. I'm from rural South Georgia, right? Door knocking. First you can't walk. You got to be in a pickup truck, and your turnover is not going to be great as it is if you're going through all of these partners and going through churches and reaching out on social media. I think that's the right operational approach. And when we work with everybody on plans, I think those plans are going to show those different modalities. We're only sort of saying for this one test, for this one day, in order for us to measure it, everybody's got to kind of do the same thing in a similar way. So we're not going to like force y'all to write a canvassing plan that only is door knocking. We want to make sure it reaches everybody in all these modalities. But when we run the test, we've got to limit it down just so we can like evaluate it. a little more with a little more rigor. Oh no, Tito, this is a great question. Oh, thanks, Pamela. Yeah, Coney Island is a good. There's so much diversity in this region, right? I mean, and that's part of what we're going to be. That's part of what we're going to be learning. So everybody's gonna have the recording of this. Betzeda, let me know if I'm getting your name right. Are we choosing based on the form, or is there another step? And if training sessions are kind of beginning in March, does that mean you'll be selecting by February? So I'll go to somebody else for the methodology part. I just want to hit on this question of training sessions. So one thing we've heard strongly from our COAD partners is a little bit like, y'all are sick of training sessions, right? Like the idea that you're going to come in. This is not going to be a situation where y'all are coming in a room and we're going to try to like teach you the incident command system. So I don't want you to think of it like that. It's going to be Angel, who's very expert in this area, doing peer discussions where everybody is an expert together and y'all are talking about what works. So I only want to say that I don't want you to think of this as like classroom. I know we're from universities. I don't want you to think of this as like classroom instruction while you're taking notes. I want you to think of it as a peer group, like a community of practice coming together to kind of work on these issues together. So who could talk about the selection process? And
So the plan is that there is no other selection criteria beyond the form. So selection step, I should say. As we've kind of mentioned a few times, we hope we get a robust response to the form. We don't know if we will. It's important that we select from, across the region, assuming that we have CENs that have the ability to conduct information sharing and participate, right? We get consenting organizations from each locality. That's something we'll be looking for. In the event that we have multiple viable candidates, we will do a random selection for participation. And then, also offer the matched alternatives or the matched CENs for the control group to those that are not selected. The plan is to select in February. That's why it's critical that we have folks complete the form by February 10th. We are on a project year for this project. And as Angel said, the plan is to do the canvassing activity in the summer. So that means that we need to get rolling with those sessions in March. So you will be notified, I think, by the end of February. And Mary, you can correct me if you have been selected for participation. And if you have questions in the meantime, you can feel free to reach out to us as well, of course. So far, we've only had one CEN complete the form, but that's why we're having this webinar, so you know what you're filling out and why. And so we really encourage you to do that so that we can get the project rolling as we plan.
Just to chime in and confirm, yes. So we're going to shoot to close the CEN capacity form submissions by February 10th and then notify the selected groups by the end of February so that we can get a first session calendared in March or beginning of April. So again, the timelines are sort of dependent on the selection groups, and we'll be working with you all collaboratively to schedule the dates that are most effective for your participation. As another note, just for context, we're asking that each CEN select up to 3 participating members. So it's not just one person participating in these meetings, but up to 3. So you can kind of divide and conquer across calendars and build out sort of an internal team to be working on this.
okay, well, let's take another minute and see if people want to raise your hands or put some questions in the chat. It's a little different. Often when people apply for funds, it's like this question of who's got the best application, right? Who like wins the grant. And in this case, it is a little different because we are looking for representative examples of folks. We want to look across the region. We need pairs, as Rachel said, pairs in similar contexts so we can kind of compare what works. So I just want to be clear that if you fill out the form and you're interested in joining the collaborative, we're super excited. If you get in, great. If you don't, it's not because you're like not a good community emergency network. This is really a sampling. It's a study sample thing, and so you shouldn't think of it as like winning or losing a grant, that kind of thing. I will note that our hope is that this is the first step in a multi-year process where we get to kind of the issues that Keith raised about connecting. We figure out how to build on this. We would love everybody on this call to be, we're going to be having calls like this as we go along. We're going to be asking for feedback in various ways. I always have to say, listen, who knows what's going to happen with federal funding? So we're trying to get as much done as we can by this September, so to make sure we can learn and grow. And then knock on wood, we're going to be back next year, taking it a step further, but we won't know that until a few months from now. So any last questions or thoughts from the group? Yeah, Amy, I'm excited about this. Honestly, I love it. I love how this builds on the good work that's already been done by New York City Emergency Management and New Jersey VOAD and other partners on the call. I think there's going to be a lot of serendipity and power in what we learn. All right. Well, thanks everybody so much for the time. Yeah, Rachel, that makes sense. Do you want to say something about that actually before we go?
Sorry, I didn't want to extend the call, but just to say we recognize there's a lot of activity in this space in the region. We're super lucky to have a very diverse region and to have the opportunity to learn from so many of you. But the hope is that in doing this work, if we do find and develop content that is helpful, meaningful, whatever, that actually can be disseminated more widely, either across the region or to whomever may find it useful. The goal is not to just create this in a small sense. And I think that we're trying to be thoughtful about all the content and components and share it as the project kind of evolves over the next several months and beyond. Even if you are not a 501c3, you can participate. Just to to clarify that question in the chat, sorry.
That makes
is
sense.
Criteria for participation. I think it may change. I don't know. I can't speak to the contracting, et cetera, but it's something we want to understand about your organization, right? If you have that formal designation, but it is not a contingent upon, it is not required, sorry, for participation.
Yeah, great question. I will just the second part of your question, Tito, I will note that we have limitations on our ability to find a place to distribute funding to y'all. So it may be that in our discussions with you, we might ask you to find that partner. It's a little bit, we can't really find a place to send the money if you don't have a place to send the money, if that makes sense. But we can be flexible about what that solutions are. And maybe to close us out, Mariah is asking to see the form one more time. And Mary, I know maybe a couple of things to close us out with next steps. We've talked about putting an FAQ out there. We've talked about people can write if they have questions. Maybe say a little bit about the next few weeks and what people can do if they're struggling with the form.
Yeah, happy to close this out. So just to ground the CEN capacity form, which we'll reshare the link in the chat right now so folks can visit the website and kind of have some of the written content and explanation shared. We're going to be closing that form formally on February 10th, anticipating, if we need to post an extension that will communicate it through kind of the outreach channels that we use to host this webinar. From there, we'll select the CENs and notify them by the end of February. Just a call for a response to sign up in the R2C newsletter for additional updates so that we can have you folks on kind of a standard communication channel and visit our website for more information. I can put my email personally in the chat kind of as the most effective way to do follow-ups and communications from this webinar. But we're very open to questions. I know that this form may be something that you need to take back to your teams to do more kind of ingestion and triage what your best position to participate in, but we're really excited and we want to have this be an open line of communication going forward. And just to note, we'll share a recording of the slide will be available, or the session today will be available on the website, and the deck will be available with that in that as well. So we can share it more broadly through your networks, and hopefully folks can get engaged if they weren't able to join us today for the webinar.
Thanks so much, everyone. We're so excited about this, and we hope to work with y'all in the collaborative and in other ways to raise the ability of our whole region to help each other from a neighborhood and community level. So thanks so much. Have a great day, and you'll be hearing from us soon.